was only improved to 15 to 25%. And with all these oral medication, panchakarma, and our lifestyle modification, patient within 5 years, today patient was admitted in 2018 January. Now it is December 2022. Patient is improved well, and his NT-proBNP level now January 2018, the NT-proBNP level was 15%, and NT-proBNP level was 25,000, and ejection fraction was 15%. And now in July 2022, his EF is 45%, and the NT-proBNP level is 192. In patient was critical in 5 years 2 times. With admitted first time with a 15% low EF, increased to 40% due to the COVID situation, history of fever. Again EF lows down to 20% in March 2020, and with our panchakarma and oral medicines it raised to 40% in March 22, and NT-proBNP was come down to 292. Since 2018 to 2022, with a continuous treatment of oral medicines, diet or water restriction and oral medication, patient improves well. My diagnosis was ISD with ischemic heart disease, with DM, with STN. EF was 15%, and NT-proBNP level was 25,000. Patient is very stable now. Patient before admitting the patient को बोला गया था कि आपको ट्रैवलिंग नहीं करना है, पेशेंट को कुछ भी नहीं करना है, और जैसे हमारा ट्रीटमेंट होने के बाद वो इंटरनेशनल ट्रैवलिंग करता है, और उनके सब जो काम है वो अच्छी तरह से प्रॉपर हो रहे हैं विथ ओनली डाइट, एक्सरसाइज एंड ओरल मेडिकेशन. थैंक यू.
Thank you, ma'am. So the next presenter is Dr. Yogita Patil. Dr. Yogita Patil. Dr. Swapnil Mandole. Dr. Swapnil Mandole. Dr. Mahesh G. Wakchure. महेश. नेक्स्ट प्रीवियस वहाँ पॉइंट करना, ठीक?
कहाँ पे?
उधर उनकी तरफ पॉइंट करना.
अच्छा वहाँ पे. ओके. Hello all, good afternoon, respected dignitaries and my colleagues. Myself Dr. Mahesh Wakchure, Medical Head, Rural OPD and Mini Clinics. I handle 35 OPDs and 30 Mini Clinics. Okay, my presentation is role of apatarvanjanya ahar in management of type 2 diabetes in rural areas of India. Okay, my objective is study efficacy of apatarvanjanya ahar in the management of type 2 diabetes in rural areas of India. Diabetes is one of the non-communicable disease in India, which is expected to rise by over 135 million by 2045. Recent studies suggest that in India, rural population or geriatric people is 9.3%, and above 45 years of age, 11.5% has been detected with diabetes. Okay, diabetes is metabolic disorder. Okay, as you know already, diabetic is संतर्पजन्य व्याधि. Okay, चरक already says आस्य सुखम स्वप्न सुखम दधिनी ग्राम्यादुक अनुप्रसा पयांसी नवान्न पानम च गुडवैकृतं च प्रमेय हेतु कफकृच सर्वम. मेदस्य मांसस्य शरीरजं क्लेदं कफो बस्तिगतं प्रदुष्य करोति मेहान् समुदीर्ण उष्णे पित्तं प्रदुष्य अपि. In our Prameya diet kit is because of Viruddhasana, okay, and then according to appetite they doesn't eat, and Adyashan. These are the major Prameya diet kit is Hetu. Okay. You know, diabetes, non-modifiable risk factor and modifiable risk factor. I am going to talk about modifiable risk factor: physical activity, high body fat, high blood pressure, and high cholesterol. Okay, in the diet it's also important. Okay, you know, clinical presentation: frequent urination, increased stress, excessive fatigue, and etc. You know the diabetic complication like stroke, heart attack, peripheral artery disease, and etc. What is apatarpan ahar? Okay, here in this slide you have mentioned 3 points. Okay, main wise. Okay, there will be the main according to the main eat according to 2000 calories to 3000 calories per day. Okay, the woman needs actually to 4000 or 400 to 500 calories less than the male. Okay, according to Ayurveda point of view, most of the diseases are created am dosha, the vitiation of Agni, it produces am. It means undigested food particle. A main cause of most Vyadhi is Ama Utpatti and Agni Dushti. Okay, Prameya is the main cause of Dusha is Kapha, and the Dhatu is Kleda. That is the main culprit of Prameya. Okay, specific combination of ahar which is less than above calories can be termed as an apatarpan ahar. Okay, as per Sushruta also mentioned, Sahaj and Apatyajanya Prameya. Okay, the Sushruta also mentioned that faulty diet and lifestyle exercise and without exercise. Okay, how diet will help to reverse diabetes? Okay, losing just 1 gram of fat in pancreas can reverse your type 2 diabetes. Okay, and diabetes is the visceral fat that is the main culprit of diabetes. Okay, my study data includes inclusion criteria is type 2 DM, BMI 25.18 to 27.89, age 30.6 to 36 years, study data 90 days. Okay, I included 187 patients, out of which 67 discontinued. Intervention Prameya diet kit. Okay, especially Prameya diet kit especially for DM. Okay, it contains calorie and portion control principles. It contains 800 kilocalorie per day. Okay, Prameya diet kit, it shows 4 diet box. Okay, 1 diet box each week. Okay, 28 diet control, pre-portion, high fiber, low calories and low carbohydrates, and high protein, high fat, micronutrient diet. Okay, since it gives only 800 calories, okay, it can be lead to apatarpan. Okay, intervention 20. Okay, Panchasutra. Okay, 800 to 1000 calories, diet compliance and timely blood glucose monitoring, drug tapering and excessive stress management. Okay, improvements in HbA1c 8.8 to previous HbA1c, post treatment was 5.96, average improvement 2.86. Okay, you can weight you can 7.15, 67.12, average improvement is 7.84. Okay, then BMI pre-treatment was 23.93, average post-treatment 24.84, average improvement BMI 3.09. Okay, abdominal girth pre-treatment 95.9, post-treatment was 84.9, average improvement was 9.9. Blood pressure already you know, previously patient taking was pre-medicine 3 medicine, and now post-treatment no AHA. Here is diabetes reversal. Okay, diabetes reversal means what? The patient has HbA1c 6.4 and there no OHA. That is we call diabetes reversal. Okay, GD negative or 25 GD negative. Okay, my conclusion is apatarpan ahar is definitely effective intervention controlling blood glucose level in diabetes remission in type 2 diabetes even in rural parts of India. Okay, thank you for my doctors is very important because doctors can present data to maintain periodic follow-up in the patient to achieve 100% compliance for diet, exercise, vital objects and like fasting blood pressure, fasting blood sugar, PPBS and HbA1c to taper down allopathic dose medicine, improvement to create awareness, educate. Okay. Thank you, OPD doctors and many doctors. Thank you. Thank you.
Thank you. Next presenter is Dr. Yogita Patil, Dr. Amritavalli GV, Dr. Amritavalli GP, GV. And then scientific paper code number AS2510. Name is not on the list, just scientific code is given. Scientific code number AS2510. Once again I will read out the name who are absent. Dr. Shweta Praveen Sarade, Dr. Yogita Patil, Dr. Yogita Patil number 2. There are two Yogita Patil in the same session. Okay. Dr. Amritavalli GV. Okay, thank you. Scientific code number AS2510. Okay, thank you. Now I request Dr. Isnelata Donala ma'am to give her comment on the session.
Thank you, coordinator sir, and my pranam to our chair sir. It's a nice session with very important session actually, with related to some issue related to cardiac ailments. And the thing is, yeah, thank you. There were actually 10 presentations, but among them, most of them are absent. Only 4 presentations were there. And in that, 2 presentations are related to one of the institution which they were claiming some reversible IHD program. In that, my comments is like, they have not mentioned actually what they are giving. Just they mention only the diet, lifestyle and panchakarma. Because this is a scientific session, you need to you need to tell actually what you have given in the 90 days. Even though if you are presenting the single case study, that single case study must be in very clear and transparent, so that the audience and those who are interested to know and to want to practice in their or adopt it in their practice, that take home message has been not gained. And the first presenter also did well, and the second is absent actually. Third presentation, that Varda Sungwekar, they also, everybody, the 4 presentators, they did their part well. And this is my comments. Thank you for giving opportunity.
May I request Dr. Anji Oza sir to give his chairman's remark on the session.
Respected co-chair, coordinator Mrutyunjay, Dr. Mrutyunjay ji, experts, professors and my colleagues who presented paper scientific in this scientific session. Just few words, few suggestions. When we try to put across success stories, whether it be one single case or number of cases, we should keep in mind, especially my young colleagues who are just starting their career as Ayurvedic physicians. One suggestion is, we should definitely use the modern parameters, technology and whatnot. But as far as the treatment protocol goes, we should try to strictly follow the Ayurveda text, number one. At the same time, when we are putting on the case study, can we put in the comparative parameters, symptoms as prescribed by our rishis? Many a times, because of the modern day influence, we try to imitate, follow the modern medical systems. I think we should feel proud, be committed to our scriptures as well as our texts, as well as the guidance which our rishis or the senior practitioners till ages have given. A small suggestion, nowadays PPT presentation is part of our life. We need to get skilled into how to present a case study. Many a times a learned audience like us, we need not, the presenter need not read each and every word presented in the slide. The audience is sharp enough to go through it. At times when we have a specific period, say 5 minutes, to present our subject, if we go on reading the various figures and various details of the PPT slide, we miss the point we would like to emphasize. So how to use the modern day technology should also be our focus point while we are putting in on our papers during the scientific session. And lastly, you will get a certificate, maybe the marks are being put on. Some of us, out of the few who have presented the case study, one will be on the top. This is our, the initial phase as a physician. Do not, if you want to succeed in life, and that is what my seniors used to teach me, and that is what the little experience I have, I would like to share with you. Success story should not get into our heads. Let us make it a point that will create success pathways as far as Ayurveda is concerned, not only the study, single case study or few case studies. So, a story has a starting, it has an end, but pathways are here for generations to come. I think we should all, especially my young colleagues, should try to create such success pathways for the future. Best wishes to all of you. Thank you.
Thank you, sir. I think there was some very useful suggestion for the presenters from Oza sir. And now it's the time to declare the best paper presenter of the session. According to the assessment made by the Honorable Chairperson, Honorable Co-Chairperson and myself, the best paper presenter of the session, this session is Ashish Bidkar. Ashish Bidkar. Whether he is present here? Okay, he is not present. Well, so the best paper presenter will be notified through mail that he has been awarded as best presenter of the session. Now it's the time for appreciation of the chairperson and co-chairperson. First, I will request Dr. Sanjeev Oza sir to honor our honorable co-chairperson Dr. Isnelata SN Dornala ma'am with the memento. Thank you, sir. Now I will myself honor our respected chairperson, Dr. Sanjeev Oza sir, with the memento. Now, with the permission of Honorable Chairperson sir, I declare that this session is concluded, and immediately within 10 minutes we will start the next session. Thank you.